Whooping cough, also known as pertussis or the 100-day cough, is a highly contagious bacterial disease. Initial symptoms are usually similar to those of the common cold with a runny nose, fever, and mild cough, but these are followed by weeks of severe coughing fits. Following a fit of coughing, a high-pitched whoop sound or gasp may occur as the person breathes in. The coughing may last for 10 or more weeks, hence the phrase, 100-day cough. A person may cough so hard that they vomit, break ribs, or become very tired from the effort. Children less than 1 year old may have little or no cough and instead have periods where they do not breathe. The time between infection and the onset of symptoms is usually 7 to 10 days. Disease may occur in those who have been vaccinated, but symptoms are typically milder. Pertussis is caused by the bacterium Bordetella pertussis. It is spread easily through the coughs and sneezes of an infected person. People are infectious from the start of symptoms until about 3 weeks into the coughing fits. Those treated with antibiotics are no longer infectious after 5 days. Diagnosis is by collecting a sample from the back of the nose and throat. This sample can then be tested by either culture or by polymerase chain reaction. Prevention is mainly by vaccination with the pertussis vaccine. Initial immunization is recommended between 6 and 8 weeks of age, with 4 doses to be given in the first 2 years of life. Protection from pertussis decreases over time, so additional doses of vaccine are often recommended for older children and adults. Antibiotics may be used to prevent the disease in those who have been exposed and are at risk of severe disease. In those with the disease, antibiotics are useful if started within 3 weeks of the initial symptoms, but otherwise have little effect in most people. In pregnant women and children less than 1 year old, antibiotics are recommended within 6 weeks of symptom onset. Antibiotics used include erythromycin, azithromycin, clarithromycin, or trimethoprim sulfamethoxazole. Evidence to support interventions for the cough, other than antibiotics, is poor. About 50% of infected children less than a year old require hospitalization and nearly 0.5%, 1 in 200 die. An estimated 16.3 million people worldwide were infected in 2015. Most cases occur in the developing world, and people of all ages may be affected. In 2015, pertussis resulted in 58,700 deaths, down from 138,000 deaths in 1990. Outbreaks of the disease were first described in the 16th century. The bacterium that causes the infection was discovered in 1906. The pertussis vaccine became available in the 1940s. The classic symptoms of pertussis are a paroxysmal cough, inspiratory whoop, and fainting, or vomiting after coughing. The cough from pertussis has been documented to cause subconjunctival hemorrhages, rib fractures, urinary incontinence, hernias, and vertebral artery dissection. Violent coughing can cause the pleura to rupture, leading to a pneumothorax. Vomiting after a coughing spell or an inspiratory whooping sound on coughing almost doubles the likelihood that the illness is pertussis. The absence of a paroxysmal cough or posttussive emesis, though, makes it almost half as likely. The illness usually starts with mild respiratory symptoms include mild coughing, sneezing, or a runny nose, known as the catarrhal stage. After 1 to 2 weeks, the coughing classically develops into uncontrollable fits, sometimes followed by a high-pitched, whoop, sound, as the person tries to inhale. About 50% of children and adults whoop at some point in diagnosed pertussis cases during the paroxysmal stage. This stage usually lasts 2 to 8 weeks, or sometimes longer. A gradual transition then occurs to the convalescent stage, which usually lasts 1 to 4 weeks. This stage is marked by a decrease in paroxysms of coughing, although paroxysms may occur with subsequent respiratory infection for many months after the onset of pertussis. Symptoms of pertussis can be variable, especially between immunized and non-immunized people. Those that are immunized can present with a more mild infection. They may only have the paroxysmal cough for a couple of weeks, and it may lack the whooping characteristic. Although immunized people have a milder form of the infection, they can spread the disease to others who are not immune. The time between exposure and the development of symptoms is on average 7 to 14 days, range 6 to 20 days, rarely as long as 42 days. 3 whooping cough pertussis vaccines are effective at preventing illness and are recommended for routine use by the World Health Organization and the United States Centers for Disease Control and Prevention. The vaccine saved an estimated 500,000 lives in 2002.